Any patient with cardiac disease need to be aware that the majority of the patients that are dying from COVID-19 has some type of form of cardiac problems. 44% of the patients that have been reported dying had high blood pressure. At least 40% of them have some type of rhythm disturbance. So although they had to be taking the proper precautions not to get infected with COVID-19, they also should be very well aware that it's important to continue their cardiac care. Because what happened is that our patients are so concerned about coronavirus that what they're doing is they're going into social isolation and trying to quarantine on their own, but they cannot do that at the expense of sacrificing the cardiac health. Because it's important that you continue receiving an appropriate cardiac care, including visiting your doctor if it is required. We know that many occasions we can do telehealth, televisit. The important thing is not to miss your doctor appointment because they can prevent you from ending up going to the hospital. When we talk about the risk of cardiac patients of having a worse outcome than a patient that doesn't have cardiac problems, there's a few reasons why. SARS-CoV-2, which is the virus that causes COVID-19, the way it affects your heart and your lungs is through a very specific receptor called an angiotensin receptor. And basically, what happened there is that, just for your visualization, it's like a little spike that attached to that enzyme. And although we do not understand exactly how the mechanism of that virus affecting your heart and your lungs are very rich on those enzymes. So if you already to begin with had a cardiac problem and now this virus is going to be attacking many of the cells in your heart, then you have higher chances of having more complications. Now, in addition to that, if you already have a cardiovascular problem, the stress that the coronavirus, this COVID-19 will cause on your system it can aggravate your cardiac disease. It can cause deterioration of your cardiac condition because of the demand that the infection itself will put in your body. The symptoms are probably going to be the same. What happens is when you already have an underlying problem, they can be more dramatic. Like the shortness of breath is not just a little shortness of breath. It can end up being the shortness of breath that you're requiring intubation. So we are not necessarily looking for different symptoms as it is the intensity or how dramatic they will present in somebody that already have an underlying cardiac problem. So besides hand washing, not touching your face, wearing a mask, keeping social distancing, is nutrition. You have to stay well, eat the proper food, because what is happening during this pandemic, which is human nature, people tend to go to the comfort food and they're not necessarily eating things that are nutritious. So we advise that our cardiac patients remain eating nutritious food, remain hydrated, and they continue to receive the cardiac care.